What's up, guys? This is Boy Miguel giving you your daily dose of radiation. Today's video, we're covering X-ray tech versus nurse job opportunity. So to give you context, I am an X-ray tech. I work night shift, 7 on, 7 off, and also dabble in day shift. I work a lot of overtime. And now what you're saying, you're like, Miguel, how do you know about the nurse world? If you're not a nurse, my lady is a nurse. So me and her talk many of times of the job opportunities that are always presented to us, and just looking online and me asking her. So I have a good amount of knowledge of that. So in short context, nursing has a higher, there's more positions to be a nurse. There's more places to work as a nurse. And I would say that the level of education for nursing is slightly more higher and the opportunities are higher in nursing. But there's also more competition. So you see how it could be a double-sided sword. In X-ray tech, you're kind of limited to less positions. And you're kind of limited to certain areas where you can work, because being an X-ray tech, you're limited to machines, you're limited to equipment, you're limited to, there's certain stuff. Being a nurse, equipment ain't the problem. It's you're using more of your skills and actually doing stuff that doesn't involve equipment to be a nurse. I know there's nurses will probably chew me out. There's a lot of equipment y'all use, but a lot of the time, our equipment is the X-ray tech equipment is very we got 3. And with these 3, this is what you do with your job. So based off of the 3 little pieces of portable equipment or whatever, you're only allowed to have set amount of patients versus the nursing staff. It's we have this giant room filled with all the equipment that you could use to help your patients depending on what they got going on. And the scalability and the amount of flow can vary over there. As far as the money goes, depending on what you do and your higher different I guess level of education, your pay could be both the same and higher. Right now, my current position with my lady, I make more money, but that's only because I work night shift, so I make more money than hers. So she's sitting, I'd say mid-20s, and I'm pushing in the 30s as far as pay wise. So there's a different level, and I mean it could even go up to, I've seen where sometimes her jobs, if she would go and do travel nursing, and if I were to do travel X-ray tech, I could probably make 50 to 60, and hers, she could make even more than I would, even traveling, same education, same everything, just because of the demand and stuff like that, which was way higher during COVID. But there's more opportunities for her to get a job in different locations versus me. The main spots where I'm gonna go work is the hospital, some sport clinics, some ortho surgery place, and some little clinic place, or urgent cares and stuff like that. That's kind of where I would get employed versus her. She can go to retirement home. She can do various stuff like that, which my version of going to the retirement and be home would be getting a mobile job. So even they have mobile nursing. That's what my lady's doing at the current moment. So there's that opportunity. So yeah, it's been with Miguel. See you on the next one.